हमारे साथ हेयर फॉल स्टार्ट होता है, हमारी स्किन में कुछ इश्यूज आते हैं, हम डर्मेटोलॉजिस्ट के पास तो जाते हैं ट्रीटमेंट के लिए, पर आई थिंक वी सेल्डम ओनली लुक एट दिस एस्पेक्ट कि ये हो क्यों रहा है, अंडरलाइन प्रॉब्लम्स क्या है. सो hair loss and these skin problems, can they solely be also because of stress? Can stress like play a major role in aggravating these things?
Okay, so before I go into the causes, let me just talk about what is normal hair loss. So if you're having about 80 to 100 strands of hair loss every day in the wash basin or on the on the pillow cover, if you see hair which is about this much, it is absolutely fine. So you don't actually count it, but yeah, just an approximate this much of hair is normal. But if the hair fall exceeds 100 strands a day, then yes, you should consult your dermatologist. Just to mention few general causes which lead to hair loss. First and foremost, as you already mentioned, stress. It's very important. It's a major cause for hair loss and your dull skin. Let's talk of other causes. Well, decreased hemoglobin. If you're anemic, you're not having proper diet rich in iron, then you can experience hair loss. It can happen if you're having some certain thyroid abnormalities. Hypothyroidism or hyperthyroidism can lead to hair loss. Some nutrient deficiency like vitamin D deficiency, like calcium deficiency, can lead to hair loss. If you undergo repeated treatments on your hair, like keratin treatment, smoothing, excessive blow drying of your hair, that can also lead to hair loss. Using shampoos and products which are rich in chemicals, which give you instant smoothing effect, but definitely there are certain chemicals which are harsh, which are added to these shampoos and conditioner, that can lead to eventually that can lead to hair loss. Pregnancy, or major illnesses like typhoid. These events in life are followed by hair loss, which of course is reversible. Pregnancy, post pregnancy for about an year or two, a lady can experience hair loss, which eventually stops. Post typhoid, post COVID, people can have hair loss, but that also eventually reverses in about an year and a half. Apart from this, a very, very important cause for hair loss is genetic baldness, which is also known as, in medical terminology, androgenetic alopecia. If a person is having baldness in the family, like your father's side or your mother's side, not in your immediate relatives, maybe in your extended relatives, that like your four grandfathers, or even before that, if somebody was bald, that gene can manifest in you. In such a case, well, you have to understand that nothing but a hair transplant procedure can get your hair back.